Have you ever looked down at your feet and thought they were just feet? What if I told you they might be trying to warn you about something much bigger, like diabetes? Most people think the signs of diabetes show up in blood sugar tests or extreme thirst, but the truth is, your feet often speak up first. Subtle changes like tingling, dry skin, or discolored nails can be some of the earliest warning signs of type 2 diabetes, long before a diagnosis ever comes. And if you ignore these signals, the consequences can be serious. But here's the good news. If you know what to look for, you can take action early and stop diabetes in its tracks. In this video, you'll discover 7 subtle foot symptoms that most people miss. Stay with me, because number 7 is the one that often goes unnoticed and can make all the difference for your long-term health. Welcome back to the channel, where we talk about real ways to take control of your health, especially when it comes to preventing chronic conditions like diabetes. If you got a family history of diabetes, if your doctor has ever mentioned you might be pre-diabetic, or even if you just want to be more proactive about your well-being, this video is for you. What we're about to talk about could help you catch diabetes early, before the complications ever start. So if that sounds important to you, make sure you hit that like button and subscribe, because we've got a lot more Health Smart content coming your way. Let's talk about why your feet are often the first place diabetes shows up. Think about it. They're the farthest point from your heart, which means they get the least amount of blood flow. Over time, if your blood sugar is high, that poor circulation affects how well nerves and blood vessels work in your feet. That's why people with diabetes often develop something called peripheral neuropathy, nerve damage that starts in the toes and spreads upward. And because these changes can happen slowly and quietly, most people don't notice until things are already serious. So let's change that right now. Here are 7 subtle signs your feet might be giving you that you should never ignore. First up, tingling or numbness in your feet, especially at night. Have you ever felt like your feet were asleep, even when you haven't been sitting, or lie in a strange position? That pins and needles sensation might seem harmless, but it could be your nerves reacting to long-term exposure to high blood sugar. This is a classic symptom of early nerve damage, and it's one of the most common signs of prediabetes or undiagnosed type 2 diabetes. Don't dismiss it as just poor circulation or something temporary. If it happens often, it's a sign your nerves are trying to tell you something. Second, unusually dry or cracked skin, especially around your heels. Now, everyone gets dry skin once in a while, right? But if you notice that your feet are constantly flaky, itchy, or splitting, even when you're using lotion, there may be more going on. Diabetes can affect the nerves that control the sweat glands in your feet, leading to less moisture and more risk of painful cracks and infections. Those open cracks can easily become entry points for bacteria, which is a big deal for someone with slow healing. So if you're moisturizing regularly but your heels still look like the desert, it might be time to dig deeper. Third, recurring fungal infections on your feet or toenails. Are your toenails thick, yellowish, brittle, or starting to lift from a nail bed? That could be a fungal infection. And for people with diabetes or prediabetes, these infections happen more often and heal more slowly. Why? Because elevated blood sugar can weaken the immune system and create the perfect environment for fungus to grow. If your nails look like they've been through a battle or your feet are constantly itchy and peeling between the toes, don't just treat it with antifungal cream and move on. Talk to your doctor and consider checking your glucose levels. Fourth, cuts or blisters that take forever to heal. Got a small blister from a new pair of shoes? A scrape you don't even remember getting? If you're noticing that these minor injuries stick around for weeks or even months, that's a red flag. Poor circulation from high blood sugar slows the healing process, making even the smallest wound dangerous. This is especially concerning because people with diabetes can develop foot ulcers that get infected and sometimes require hospitalization, or worse. So keep an eye on how fast your body heals. It's one of the clearest signs that something inside isn't working the way it should. Fifth, noticeable changes in color or temperature. If your feet are constantly cold, pale, or even bluish, that can mean reduced blood flow. On the other hand, if they're red, swollen, or unusually warm, it could be a sign of inflammation or early infection. Either way, these changes shouldn't be ignored. Diabetes affects how blood flows through your body, especially in the extremities. So if your feet look or feel different than usual, and it's not because of the weather, your circulatory system might be under stress. 6. Burning pain or aching without an obvious cause. This one often catches people off guard. You lie in bed and suddenly feel a deep, burning ache in your feet, but you didn't bump them or strain anything. That's often nerve pain, a signal that the nerves are being damaged by high blood sugar levels. It can range from annoying to debilitating, and if left untreated, it only gets worse. The tricky part is that this kind of pain can come and go, so people tend to brush it off. But remember, pain is a message, and in this case, it's one you should listen to. And finally, number 7, loss of sensitivity. This is perhaps the most dangerous symptom because it sneaks up on you. You might step on something sharp and not feel it, or burn your foot on hot pavement without realizing it until it's too late. When your nerves are damaged, your ability to feel pain, heat, or pressure can disappear. That makes it incredibly easy to get injuries that go untreated. And untreated injuries in diabetic feet can lead to infections, ulcers, and even amputations. That's why this is a number 1 symptom to take seriously. If you notice you're not feeling your feet the way you used to, it's time to act. These may seem like small things, dry skin, tingling, a stubborn cut, but together, they tell a bigger story. Your body is always talking to you. The question is, are you listening? If you've noticed 2 or more of these symptoms, even if they seem minor, don't ignore them. Schedule a checkup, ask for a blood glucose test, and share your concerns. Early diagnosis can prevent nerve damage, circulatory problems, and so many complications down the line. You deserve to live a life full of energy, mobility, and health. And it starts with paying attention to the signs. If this video helped you learn something new, give it a like and share it with someone who might need to hear this. Let's spread awareness and help more people catch diabetes before it catches them. And now, I want to hear from you. Have you experienced any of these foot symptoms? Drop a comment below, and let's start a conversation. Don't forget to subscribe for more tips on how to take charge of your health naturally. Until next time, take care of yourself and your feet.